Welcome to the Patient and Caregiver class at the Sarah Cannon Transplant and Cellular Therapy Program at St. David's South Austin Medical Center. My name is Carrie Martin, and I'm the social worker at our program. We're glad you've joined us today. We're going to do a general overview of what you can expect during the transplant process. You will also receive written material from your transplant coordinator, as well as hands-on teaching from our nursing staff about what to expect during your transplant experience. The topics we're going to cover today are the stem cell transplant process, role of the caregiver, valuable resources, nutrition, the chaplain, medication management, and home safety. We're also going to meet your team. Your team consists of providers or doctors, the transplant coordinators who are nurses, our inpatient staff, our clinic staff, pharmacy, dietitian, chaplain, and social worker. Here's a general flow chart of the stem cell transplant process. After mobilization of stem cells, we'll collect the stem cells, and then we will begin a conditioning regimen, whether it be chemotherapy or radiation. And then you will go to transplant day, which is day 0. We refer to that as day 0. And from then on, we'll refer to each day as day +1, day +2, until you have completed engraftment, which is recovery of your blood counts. And usually at that time is when you're discharged from the hospital. So let's talk about the journey from day 0 and beyond. While the stem cell transplant team tries to standardize guidelines and recommendations for patients, each family's journey through the transplant is unique. As I mentioned earlier, here's your stem cell transplant team. It's composed of transplant doctors, transplant coordinators, nurse leaders, pharmacists, nurses who are actually on the floor and in the clinic, a registered dietitian, social worker, case manager, chaplain, and advocate. On our team, we also have physician assistants and nurse practitioners. We know that a caregiver plays an important role in transplant and in the patient's health care and recovery. In fact, most transplant centers require patients to have a caregiver to help care for them throughout the transplant process. As a caregiver, you'll be called on to gather information, talk to doctors, participate in your loved one's care, and provide support. In your role, we know it can be overwhelming to be in a new world of medical terms, test results, and treatment choices. Each transplant patient's needs are different. So talking with your loved one ahead of time will give you a better understanding of his or her expectations. As a caregiver, you will be responsible for a lot of the day-to-day medical, practical, and emotional support needed during the transplant, and we encourage you to be an advocate. Let's talk about the medical support role as a caregiver. That role includes communicating with the healthcare team, administering medications as scheduled, monitoring and recording of oral temperatures. We encourage you to take it twice a day or when you're not feeling well. Encouraging walking and sitting up in a chair, monitoring and reminding the patient of liquid intake, reminding the patient to do mouth care, noticing changes in condition, and calling for medical help in an emergency. The practical support as a caregiver includes escorting the patient to and from clinic visits, assisting with financial and insurance issues. You can check with your social worker about the possibility of grant funding options, helping prepare meals according to a low microbial diet, maintaining a clean environment at home, reminding the patient to shower daily, keeping family members and friends up to date, and managing the number of visitors and preventing contact with ill family and friends. And we encourage masks for patients when appropriate. The emotional support required as a caregiver is paying attention to patients' moods and feelings, communicating and listening to them, and understanding their needs and helping them make decisions. Being a caregiver is a full-time, 24-hour, 7-day-a-week responsibility. It is tiring, demanding, and stressful, especially if the patient's condition or their schedule or their treatment changes. You may not be able to work and will need to stay with your loved one for most of the day or night, especially when they discharge from the hospital. The caregiver must escort the patient to and from the outpatient cancer care clinic. While at the outpatient clinic, you can take some personal time, and this is something we strongly recommend. It is important for you to maintain a positive attitude, calm demeanor, and flexible approach while also providing support. We also encourage you to take care of yourself. Caring for someone throughout transplant can be demanding and full of unexpected twists and turns. One of your greatest challenges may be taking care of yourself while caring for your loved one. The most important thing you can do is to take care of yourself first. Here's some resources and different websites that provide that type of support and information it takes to be a caregiver. As a caregiver, here are your rights. You have the right to take care of yourself, to rest when you're tired, to eat well, and to take breaks from caregiving when you need them. You have the right to recognize your limits of your own endurance and strength, to seek help from family and other involved parties and the community at large, to socialize, maintain your interests, and do the things that you enjoy, to acknowledge your feelings, positive or negative, including frustration, anger, and depression, and to express them constructively. And finally, to take pride in the valuable work that you do and to applaud the courage and inventiveness it takes to meet the needs of your care recipient.
Hi, my name is Jennifer Lancaster. I'm a registered dietitian with a specialty in oncology nutrition, and I'm going to talk to you about food safety. It's important to follow the food safety guidelines that I'm going to discuss today, as it can help reduce the risk for having foodborne illnesses. And food safety starts at the grocery store. So when you first go into the grocery store and you're shopping for your perishable food, consider shopping for these food items if they're cold or frozen at the end of your trip rather than the beginning. And as you're shopping for them, think about, are they being stored at a safe temperature in the store? So basically that means don't select perishable food items from a non-refrigerated aisle display. Try not to pick packaging that's torn or leaking. And your raw meat and poultry, put it in a plastic bag. That way, if it did happen to drip, it won't drip on your fresh fruits and vegetables. And then as soon as you get home, think about putting away your cold items and your frozen foods. Put those away first. Moving on to shelf-stable foods. Don't purchase them if your cans happen to look like they're dented, leaking, or bulging. Try to avoid getting cracked glass jars or torn packaging. And definitely, if you see that the tamper-resistant safety seal has popped, if it's not intact, don't buy that food item. And product dating is not required by federal regulations, but I do want you to look for expiration dates. And if you don't see an expiration date, then observe the use-by date found on products and consider that to be the expiration date. And of course, I don't want you to use that food item if it's beyond the expiration date. Follow all expiration dates. If you happen to be at the deli, you want to make sure that the clerk that's helping you is washing their hands appropriately, especially between handling raw and cooked items, or puts on new gloves. Don't buy cooked, ready-to-eat items that happen to be touching raw items or displayed in the same case. And think about your hot dogs and deli-style meat or commercially packaged meat. You want to avoid those unless they have been heated until they're steaming hot. Moving on to home, in your refrigerator, you want to make sure that your refrigerator is staying cold enough. You can use a thermometer, and if you have one, you want to make sure that your refrigerator is cooling to 40 degrees or below. Another place that you want to make sure that the juices from your meat and poultry that might be thawing out is not dripping on other foods. So you may want to put a pan underneath it or a plate underneath it. Leave eggs in the carton for storage. Don't place them in the door of the refrigerator. Instead, use maybe towards the back of the refrigerator. It just helps to keep it colder. Keep your refrigerator clean. Your ground meat, your poultry, your fish, you can store it up to 1 to 2 days, but other red meats, for example, like a steak or a roast, can be stored up to 3 to 5 days in your refrigerator. And after you've done your cooking, you want to use your food or eat your food within 3 days, or freeze it for longer storage, but after 3 days, you're going to want to throw it out. Your freezer, just like your refrigerator, needs to be kept at a certain temperature, and it needs to be at 0 degrees, and all the food in there will always be safe if it's kept that cold. Foods that are in the freezer, if they stay in there for a long period of time, you may notice that the quality suffers with lengthy storage, but this is the one time there is no concern if your food item, if the date expires while the product is frozen, it is still okay for you to eat once it's thawed out. But once it's thawed out, you have to remember that those microbes that were on the food can still become active. So you still are going to handle that thawed item just like any other perishable food item. In your pantry, you want to make sure that you're storing canned foods and other shelf-stable products in a cool, dry place. You know, don't put them in the stove, not under the sink, or in a garage or in a basement, or really any place in your house that they might be exposed to high or low temperature extremes. And of course, once again, you're going to follow all expiration dates on your label. So food handling, it's important because foodborne illnesses can be caused by improper food handling or how you prepare things in your house. So you want to make sure that you're washing those utensils, your can openers, your cutting boards, the countertops in hot soapy water before and after coming into contact with your raw meats, poultry, fish. You want to make sure that, you're washing your kitchen towels and your cloths often in hot water in a washing machine. And make sure that, you're washing your hands with soap and warm water before and after handling food items, after using the restroom, changing diapers, or, touching the pets that you may have. So your cutting boards, non-porous surfaces such as plastic, marbled, tempered glass, pyroceramic, they're easier to clean than wood. And the reason being is wood surfaces are considered to be porous. So, if you have plastic cutting boards, those may be a little bit better than your wooden cutting boards. Consider using a separate cutting board for your fresh produce and a separate one for your raw meat, poultry, and seafood. And this basically helps prevent cross-contamination. And always, you're going to wash with hot soapy water or place it in the dishwasher. Solid hardwood cutting boards, they're dishwasher safe, but wood laminates are not, and you don't want to put those in the dishwasher. If you're interested in sanitizing solution, you can use a tablespoon of unscented liquid chlorine bleach to 1 gallon of water, and using more bleach is not necessarily a good thing. So you want to make sure that you're following that ratio. So some other things to think about when you're cooking is not eating undercooked meats or raw meat, raw poultry, fish, or eggs. Consider using a food thermometer to be sure that those things have reached a safe minimum internal temperature. And below, you will see a list of different cuts of beef, chicken, pork, eggs, and what's considered a safe temperature to cook that food at. And just remember, stuffing poultry is not recommended, and you want to cook your stuffing separately. And it's also important to make sure that you are reheating leftovers appropriately. And also there is a temperature listed for leftovers as well. So leftovers, just think, bacteria begins to multiply rapidly in the danger zone. And what we call the danger zone is between 40 and 140 degrees. And basically that means foods are not kept hot enough and foods are not kept cold enough. So you don't want to leave your food sitting out at room temperature for a very long time. Think not leaving your perishable food out of the refrigerator for more than 2 hours. And if it happens to be above 90 degrees, then you're limited to leaving your food out for an hour. And then you definitely want to make sure that you're either refrigerating it or you're putting it in the freezer. To help bring foods down quicker to a safe temperature, consider dividing your leftovers into shallow containers. Cover them with airtight lids, or aluminum, plastic wrap, whatever works. But you're covering them because the bacteria from the air, people's hands, can also contaminate the leftovers. So you definitely want to cover them. When you reheat them, you definitely want to make sure that you're reheating those leftovers thoroughly, whether it's in an oven or a microwave. It needs to be heated all the way through and to that appropriate temperature that was listed on the previous slide. Think of reheating your foods only one time and then discard them. That helps to maintain the actual quality of your food rather than reheating them multiple times. And actually here at the bottom of this slide, it's a reminder, reheated foods should reach 165 degrees throughout the food. So when your doctor says that it's okay to eat out, it's okay to eat out. Some guidelines to think about, though: avoid going to restaurants during peak times. Select a restaurant that has a reputation for being clean. Ask that your food be prepared fresh. And so this also, too, means you probably want to avoid foods that are sitting under a heat lamp. Consider using single-packet condiments. Avoid salad bars, delicatessens, buffets, sidewalk vendors. Yogurt and ice cream from soft-serve machines can be risky as well. And then raw fruits and vegetables, they're a little riskier, and we recommend avoiding them outside of the home. But in the home, it's okay to eat raw fruits and vegetables because you can ensure that you're washing them very well. So while your loved one is in the hospital, visitors are welcome to bring food, but I do recommend that they're prepared with the same guidelines that we just discussed. There is a refrigerator that can be used to store food, but after 24 hours, it will be thrown away. And we would prefer that you not have takeout foods from restaurants or fast foods while you are here. And again, that's to help prevent foodborne illnesses. So in summary, observing safe food handling techniques, some things to think: wash all your fruits and vegetables. Even those that have a peeling that you wouldn't eat, for example, a banana, still needs to be washed. Thaw your meat in a microwave or refrigerator and use it right away. It's not a good idea to thaw your meat out on the counter or in the sink. All meat should be cooked until well done. No raw seafood, raw eggs, or raw meat. Cook your eggs completely until the egg whites are completely hard and the yolks are thickened. Don't leave your perishable food items out for more than 1 hour if it's above 90 degrees, and if it's below 90 degrees, you have 2 hours. Check expiration dates on all your food items. And if you ever have any questionable food that you're wondering about, throw it out. When in doubt, throw it out. Keep all your hot foods hot, your cold foods cold, and avoid well water.
Hi there. My name is Cam Burton, and I am the coordinator for spiritual care and clinical ethics at St. David's South Austin Medical Center. I'm here with you today to talk about spiritual care and advanced directives in medical decision making. One of the most important things that we want you to know as caregivers is that chaplains are available for spiritual support for you and your loved ones 24 hours a day, 7 days a week. The easiest way to request support from our spiritual care services and chaplains is to ask a nurse or a staff member and they will call us. We are in-house Monday through Friday, 8 a.m. to 5 p.m., but we do have coverage on call overnight and on weekends. If you'd like to contact us in the office, you can see our office contact number is there listed on this slide. Feel free to call us and leave us a message and we'll return it and get back with your need as soon as possible. Another important thing to know about our facility is where our chapel is located. Our chapel is located on the 5th floor on the South Tower. It's a wonderful place of meditation and reflection. You'll be able to find it easily by noticing the big etched glass window inside the door and following the signs in the South Tower to the chapel. The chapel is open 24 hours a day, 7 days a week, and we hope that it will be a space of respite and peace and meditation for you. The role of chaplains in spiritual care is to support the emotional and spiritual needs of patients and their families. Chaplains represent a practice of interfaith care and spirituality, meaning we support what supports you as a patient or family member. We are also available to facilitate ritual and religious resources for you. If you have a particular need according to your tradition, please let a chaplain know, and we will do our best to connect with community faith leaders to provide that for you if it is something we cannot do ourselves. For instance, if you are a Jehovah's Witness and you need help navigating the blood care as part of your treatment process, or if you're a Roman Catholic patient who requires communion, confession, or anointing of the sick from a priest, we're happy to help facilitate those contacts for you. Chaplains also provide support through life challenges and time of illness. We help families and patients discern difficult decisions, and we also assist with medical directives. There are 3 different types of medical directives that we're going to talk about today. The first type is what's called the medical power of attorney. This is a document that lets someone appoint an agent to make treatment decisions for them if they ever become incapable of doing so. Even without a formally designated medical power of attorney form, the legal next of kin may serve as a legal decision maker for a patient. The second form that we like to talk about is the Advance Directive to Physicians, Families, and Surrogates. Sometimes this is also known as a living will. This document lets someone dictate their treatment preferences in the event that they are in a terminal or an irreversible condition. It lets you dictate whether or not you would like to continue life-sustaining treatments or preferences or allow death to happen naturally. This form can also be used to highlight any particular special requests that you may have as a patient. The third type of medical directive that we talk about is an out-of-hospital do not resuscitate order. This directive is different from the other 2 that we have talked about because it is actually a physician's order and must be signed by a physician for it to be valid. This form acknowledges someone's preference to not be resuscitated in a venue that is outside of a hospital healthcare facility. We usually implement these forms in times of terminal illness or in times of hospice treatment. There are 2 other types of directives in the state of Texas that we very rarely talk about, but we want to mention them to you as they can be part of the things that you discuss with your loved ones as you outline your goals of treatment. The first one is the Medical Health Treatment Declaration, which designates the kinds of mental health preferences someone may have in the event that they are incapacitated. And the last one is the Organ and Tissue Donor Card. This lets someone express their preferences on organ donation. We typically don't do a lot of these in the hospital because it is part of the process of getting your driver's license, but it is an option for you to do. Also important to note is that the chaplain's office is ready to provide education and support and help completing medical directives if you ever need it. Just simply ask the nurse to call the chaplain and have them come assist you with directives. So why do medical directives? Medical directives are important because they help minimize the stress, the worry, and the guilt out of making difficult decisions for loved ones and patients. We like to encourage people to have these conversations about goals of preferences and treatments options with their family and their loved ones often and have them early. It is also a key tool in helping healthcare providers by giving them the directions for the kind of care you want. We encourage everyone to think about these healthcare decisions and talk with their physicians and their loved ones and families about how they feel. If you decide to do directives and you have written those down or you have them verbally expressed, make sure that your doctor, your treatment team, and your family and anyone who might be making decisions on your behalf know what those preferences are and have copies of anything that is documented. We would like to have copies of your advance directives in your file, so please make sure that you provide those to us if you decide to complete them. One of the things that happens as you go through this process is that you as a caregiver may become a surrogate decision maker for your loved one. So I'd like to talk a little bit about what that looks like and the role of a surrogate decision maker. The main purpose of this role is for you to advocate for the person that you are making decisions for. You are making decisions on their behalf if and only if they are incapable of making those decisions. We know that it can be difficult to facilitate these decisions on behalf of someone else, which is why we encourage you to have conversations about treatment preferences and document wishes. It's also very important to make these decisions based on the stated preferences of your loved one, such as advance directives or anything that is known about treatment preferences, even if it's just a simple conversation about whether or not you would want to be on life support. We'll also want to make this decision based upon the best medical practices and standards of care as it relates to quality and dignity of life. It's very helpful for you to converse with your loved one about the goals and preferences of care and to communicate and stay informed about the patient's condition. There are many medical decisions that will have to be made over the course of any illness, and these will need to be made either by the patient or yourself, but we know that sometimes these things are often made as a family. They usually will deal with whether or not to start or continue a particular treatment during the course of an illness. So who makes these decisions? You do, as a patient, as a family member, or as a surrogate decision maker. We believe strongly that patients have the right to make decisions about their pursuit of medical treatment. But in order to do that and to make wise choices about your treatment, you have to first understand the illness. Make sure that you're kept up to date about what the condition is, what the available treatment options are, and what the chances are for recovery. It's also important to know your prognosis. This is a big fancy word that means what the illness will do to your health over the next few days, weeks, and months. It is also helpful to understand how the treatments that are being offered will affect the prognosis going forward. Keeping all of these things in mind will help make you make the best values-based decisions about your medical care for either you or your loved one going forward.
Hi, this is Betsy Jakunski, a stem cell transplant coordinator at St. David's South Austin. I'm going to talk about the home environment, pets, infection prevention, and symptom management around a stem cell transplant. First of all, the home environment, cleaning. Transplant patients don't need to be in a sterile environment. A high level of normal cleaning is generally adequate. Solutions containing bleach should only be mix 1 part of bleach to 10 parts water. Daily cleaning of frequently touched surfaces, such as doorknobs and kitchen bathroom counters, is expected. For pets, animals can carry diseases and they may present risks to your loved ones while their immune system is compromised. During the transplant period, chemotherapy through recovery, you should minimize direct contact with your animals. We don't have you get rid of your animals, but if you pet the animal, you need to make sure that you are washing your hands afterwards, that you're not letting them jump up and bite you or scratch you. And there's no cleaning up after the pet of any kind by the transplant recipient. You should also take into the following precautions: current immunizations with your pets, pre-treat for fleas and ticks if indicated, do not allow them to sleep in with your loved one, do not allow pets to lick your loved one's face, Wash your hands after touching your pet. Prevent bites and scratches. Your loved one cannot clean cat litter boxes or clean up after your dog. And avoid all contact with birds, lizards, snakes, turtles, iguanas, exotic pets, hamsters, or other rodents. Feeding your pet. Just like people, pets can get diseases from contaminated food. Pets should be fed only high-quality commercial pet foods. If eggs, poultry, or meat products are given to your pet as supplements, they should be well cooked. Any dairy products given to your pets should be pasteurized. Pets should be prevented from drinking toilet bowl water and from having access to garbage. And do not let your pet scavenge for food, hunt, or eat other animal feces. Getting a new pet. Discuss getting a new pet with your transplant physician or oncologist if within the first 6 months after transplant. When getting a new pet, avoid animals that are ill, stray, are younger than 6 months old. These animals are more likely to carry diseases that can make you ill. Next, we're talking about your environment and what areas you might need to avoid. So construction sites and working with plants or soil. Risks of being infected by a mold called Aspergillus is one of the things we worry about a lot in our post-transplant patients. So widespread in nature, especially in decaying matter, water, soil. So it's very prevalent in the outside world. And patients with impaired immune system, Aspergillus can cause infections of the lungs, skin, sinuses, or brain, and can be aerosolized and inhaled in certain circumstances, including construction and when working with plants or soils. Patients are discouraged from being on construction sites and doing yard work for 3 to 6 months post-transplant. Frequently asked questions after transplant. Typically discouraged in the first 3 to 6 months after transplants are hot tubs, swimming, gardening, mowing the lawn, raking leaves, digging in soil, making or kneading yeast breads, carpentry work, woodworking, handling wild and game animals, horseback riding, traveling to developing countries. If there is anything on that list that you are interested in doing, we encourage you to discuss it with your transplant physician or oncologist. Symptom management at home. By the time the discharge, most side effects of the transplant will be resolved, but lingering side effects will be potentially diarrhea, nausea and taste changes, dehydration, bleeding from low platelets or thrombocytopenia, and fatigue. Fatigue is usually the longest lasting symptom. For diarrhea, I recommend that you have Imodium in the home, and Imodium is what they'll use as the first line for diarrhea. Make sure you're drinking plenty of fluids. Make sure that your loved one is eating small amounts of food throughout the day instead of 3 large meals. Eat low fiber foods such as white bread, white rice or noodles, cream cereals, ripe bananas, canned or cooked fruits without skins, cottage cheese, yogurt with seeds, eggs, mashed or baked potatoes without the skin, pureed vegetables, chicken or turkey without the skin, and fish. Again, for diarrhea, foods to avoid are high fiber foods such as whole grain breads and cereals, raw vegetables, beans, nuts, seeds, popcorn, and fresh and dried fruit. Avoid very hot or very cold liquids. Avoid caffeine, tea with caffeine, alcohol, and sweets. Avoid fried, greasy, or highly spiced foods, and avoid milk and milk products, including ice cream. For symptom management, as we move on into nausea, for morning nausea, try dry foods like toast or crackers before getting up. Drink cool, clear, unsweetened fruit juices. Suck on mints or tart candies. Peppermint is a natural anti-nausea medication. Wear loose-fitting clothing. Breathe deeply and slowly when you feel nauseated. Distract yourself by chatting with friends or family members, listening to music, or watching a movie or a TV show, and use relaxation techniques. Furthermore, residual nausea may persist upon return home, and anti-nausea medications as prescribed might include Zofran, Compazine, Ativan, or Phenergan. Try to drink liquids at least an hour before or after mealtime instead of with your meals. Drink frequently and drink small amounts. Eat and drink very slowly. Eat small meals throughout the day, usually every 2 hours. And then avoid foods with extremes of temperatures, strong smells, sweet, fried, or fatty foods. Moving on to symptom management of dehydration. Dehydration can occur if there is not enough fluid intake. This can be due to the excessive loss of fluid from diarrhea, vomiting, fevers, and sweating. Recognize the symptoms: feeling dizzy or lightheaded, decreased urination or dark, stronger smelling urine, and increased weakness. Things you can do at home are to promote fluid intake, and that would include drink as many liquids as possible, avoid caffeinated beverages such as coffee, cola, Diet Cola, hot or iced tea, or hot chocolate. And for every caffeinated beverage that you do drink, we want you to follow it with 1 glass of water. Moving on to symptom management for bleeding. To decrease your risk of bleeding, use a soft toothbrush. Assist with ambulation to prevent falls. Don't use suppositories, enemas, or tampons. Avoid sexual activity other than closed mouth kissing, hugging, or gentle masturbation. And do not put objects or fingers in the vagina or rectum. Please reach out to your physician regarding when the most appropriate time might be for you to resume, or your loved one to resume, sexual activity. And then moving on to symptom management for fatigue. Help your loved one cope with fatigue. Plan the day so that they have time to rest. Encourage short naps or breaks rather than one long rest period. Save energy for the most important things. Try easier or shorter versions of activity. Take short walks and do light exercise if possible.
The following slides are an overview of medications that your loved one will be taking when they go home from the hospital. My name is Polly Hunley. I'm the pharmacist on the inpatient unit. And before your loved one discharges, I or a fellow pharmacist will be in to see the patient and the caregiver and give you a list of medications that the patient will be taking, how to take them, and we'll answer all questions. So you don't necessarily need to memorize what we're going to talk about here. This is just an overview. One of the medications that the patient will be going home on is an antiviral. This may either be acyclovir or valacyclovir. They're very similar. They offer prophylaxis against viruses, which is a risk for up to 1 year after transplant. So the patient will be taking the medication for up to a year. It's very important to take the medication at the same time every day and not to skip a dose. If the patient skips a dose, we can talk about how to handle that. If it causes upset stomach, you can take it with food and that should help. Generally, we'll have a sense of how patients are tolerating these medications before they go home because they have already been on them at home or they've taken them while they're in the hospital. However, there are side effects that should be reported. If there is swelling of the face, yellowing of the skin or eyes, confusion, hallucinations, rash, or itching, please contact the physician to discuss those issues. Other medications the patient goes home with will be to treat or prevent nausea or vomiting. Typically, by the time a patient is ready to go home, these are both under control and they shouldn't be experiencing too much nausea or vomiting, but we like to give some options in case you get home and there are some issues. So we'll be hopefully preventing it, and if not preventing it, controlling it after the fact if they are having some vomiting. We use some different approaches. Medications are used in different ways, and if one doesn't work, another one may work a bit better. So we usually give 2 or 3 options. One of those might be Zofran. This is generally our preferred first antiemetic to treat nausea and vomiting. It does not cause drowsiness, which is why we prefer to use it first. And it's very well tolerated. It doesn't often cause issues, but you would want to report if you feel a change in your heart rate or have a headache or otherwise have some kind of an identifiable allergic reaction. Usually this is taken several times throughout the day if needed. If this medication does not control nausea or vomiting, then we move on to a second line option. That is compazine or prochlorperazine. It can cause some drowsiness, so that's why we choose to use it second if Zofran is not working. Again, other than drowsiness, it's well tolerated. There are some side effects noted at the bottom of this slide, which would be problematic, including new or unusual muscle movements or uncontrolled movements of the tongue, restlessness, blurred vision, or an identifiable allergic reaction. If Zofran doesn't work and compazine as the second option doesn't work, then we generally have a third option of Ativan or lorazepam. This is the third choice because it can also cause some drowsiness, and therefore the patient should avoid drinking alcohol or driving after they've taken this medication. If the three of these medications have been tried and nausea or vomiting is still not relieved, we ask that the patient or the caregiver calls the hospital and talks with a nurse or a physician to see if something else needs to be done. The other issue that people sometimes have when they go home is lingering diarrhea. Again, most of this should be resolved by the time the patient is discharging, but we do ask that people pick up some Imodium, just the over-the-counter medication that you can get at any major pharmacy or usually at the grocery store, and have that on hand. You can take it per package instructions on the back of the package. One caveat or one difference is that you could take 2 tablets the first time the patient has diarrhea, and then afterward just take 1 as per the package instructions. Do not exceed 8 tablets in 24 hours, however. Again, if the patient has tried this medication and the diarrhea is not relieved, then we ask that they contact the nurse or physician to address issues.
I hope this class has provided you with some basic and practical information. If you have further questions, please contact a member of your transplant team. Thank you so much for taking time to learn about the stem cell transplant process here at the Sarah Cannon Transplant and Cellular Therapy Program at St. David's South Austin Medical Center. We truly do appreciate your participation and your care.